Good afternoon and welcome to the afternoon session of Labor, Health and Social Services. We're going to continue on with our agenda, and next up is Workmen's Compensation, Public Safety Communication Workers. Are there any agencies? Okay, would you come up, please? Good afternoon. Hi. Good afternoon. Please just identify yourself and then we'd be interested to hear what you have to say.
Thank you, Madam Chairman. I am Liz Gagan, and I am the Director of the Department of Workforce Services. And with me, I have Deputy Director Jason Wolf and our Administrator of Workforce Standards, Karen Biebensee. And Deputy Director Wolf will briefly go through the memorandum that we supplied to the committee. And then we're here to answer any questions that you may have.
Thank you, Madam Chairman. Again, Jason Wolf with the Department of Workforce Services. So maybe just a brief refresher from this topic and how it came up. I think, I believe it was submitted as an interim topic by another entity. But at the time, I think if I could just draw your attention, I guess, to the memo we submitted. I don't know if anybody's had a chance to look through that yet, but kind of just an overview of why this is a topic and kind of what we could possibly do about it. So the emergency dispatchers or public safety telecommunicators, I'll use that term interchangeably, but for simplistic sake, I'll just call them emergency dispatchers. So they would currently be covered under workers' compensation as an employee. I think most of those folks fall under, cities, counties, towns as employees. So they would be covered under workers' compensation for injuries like slips and falls or cuts or what have you. But they would not be covered for what we would call mental health treatment absent a physical injury. So the way the Workers' Compensation Act is structured currently is that a person would only be an employee like myself or just a normal employee would only be eligible for mental health care if it was in conjunction with a physical injury. So if I had some mental trauma as a result of my physical work injury, I would qualify. If you notice in 2020, that Senate File 117 that was passed in 2020 budget session added a definition of first responder to the Workers' Compensation Act. And under the current definition of a first responder are things that you would expect: police, firefighter, search and rescue personnel, et cetera. Currently, the public safety telecommunicators or emergency dispatchers are not considered a first responder under the definition. And because of that, they are not eligible for mental health treatment unless they were to have a compensable physical injury that we covered, and they suffered some mental trauma as a result of that physical injury. So kind of moving through the memo there, a little bit of background there for you. In the data section, we've pulled some statistics from the Bureau of Labor Statistics. Currently in Wyoming, there's about 350 emergency dispatchers. And on page 3 of that memo, you can see those broken out and how many are in each classification. For instance, firefighters, 680 of those, paramedics, 260, and then the public safety telecommunicators or emergency dispatchers, 350. And then that table below is for the supervisory roles of those same classifications. So again, we pulled some data back from when we pulled data actually from 2023 through 2025, looking at those claims that we've had since that first responder definition became part of the Workers' Compensation Act. Looking at that, we've had 30 claims in total between 2023 and 2025 that have been filed. And again, those are just claims that would have suffered some sort of mental trauma absent a physical injury. So a good example is maybe say somebody shot somebody or somebody saw somebody get shot. They had some post-traumatic stress or whatever from that. We would cover that under workers' compensation if they were a police officer, firefighter, the way the law is currently written. So, but we wouldn't cover that for the emergency dispatcher that took the initial call, let's say. They currently would not be eligible for that mental health treatment unless they had a physical injury. So I'll pause there, Madam Chairman, and just see if there's any questions.
Any questions, committee, for Mr. Wolf? I have a couple. Okay, first off, what does the mental health treatment look like? Is that psychological? Is primarily that's what it is?
Madam Chairman, exactly. Yep. So if somebody had, again, a good example is a police officer that maybe had to discharge their firearm, and they had some maybe post-traumatic stress from that incident, they go and seek mental health treatment under workers' compensation. Because they're a first responder, we would cover them for that psychological treatment.
Okay. As a follow-up, how long are people usually under this sort of treatment? I mean, is it normal for a few visits or a year, or what's a normal?
Yeah, Madam Chairman, great question. So again, kind of looking back at the 2020 bill that passed, creating the definition of first responder and also kind of altering some of the statute as to how long one's eligible for that. They are currently eligible for no more than 36 months of mental health treatment. And I would say in the data that we have, that varies far and wide. I mean, it could be a few visits to multiple visits over a year. I think it just varies according to the diagnosis and what the healthcare provider feels that they need.
Okay. And the other thing I was wondering with, and maybe you'll cover this, and if so, that would be fine. But when you look at unemployment, that is one of the offices or agencies, however you want to call it, that usually is running with sufficient funds for sure. Is this, I mean, he said 30 instances. Is this something that the Department of Workforce Services really supports as far as being able to handle the additional people that will be affected there, or not?
Madam Chairman, yeah, so I think just to be clear, unemployment and workers' compensation are two separate funds. And so that's probably handy for everybody to know. Yeah, I think, and I guess just if I understand your question is, do we have the capacity to handle potential incoming injuries like this? And I would say absolutely, we have the capacity to handle that, both from a financial perspective and from a manpower perspective.
Okay, thank you very much. Anyone else? Senator Scott.
Sure. Overall status for these days, I'm starting to hear there's significantly more in the fund than the actuaries say that we need to cover all the claims that have potentially been incurred. Is that correct? And if so, by how much?
Madam Chairman, Senator Scott, so if I understand your question, how much more above our liabilities do we have in the fund? So, Madam Chairman, so currently the Workers' Compensation Fund is roughly about 2.8 billion with a B, billion. And our liabilities are about 2.2 billion. So we have about $600 million more than we need in the fund. And I say more than we need, but I think you understand that the actuarial work is an estimate, and we often have claims that run off adversely from what is predicted by the actuary. So that's the reason for the excess funding in the workers' compensation fund.
Representative Rodriguez Williams.
Thank you, Matt. Oh,
Go
follow up.
ahead.
You sure?
Yeah, I'll come back.
Thank you, Madam Chairman. Deputy Director Wolf, in your agency's research, how many other states cover dispatchers for mental health trauma? And then second, if legislation were to pass to include them, your memo states it was, if I remember correctly, 300 and some odd dispatchers in the state. What would 350 emergency dispatcher positions in Wyoming? What would the fiscal note be? What would the cost be for the agency?
Madam Chairman, Representative Rodriguez Williams, yes. So the memo, again, you're correct, 350 dispatchers. As to your other question, in the memo there, I note that over 25 states have currently created statute or through some kind of executive order added the emergency dispatchers to their definitions of first responder. As to what the fiscal note would look like, I mean, it's a little hard to predict. Using those claims that I put in the memo as a gauge, over the course of 3 years, we've spent about $63,000 on those 30 claims. So, I mean, if we kind of use that as a gauge is probably, again, probably what we would use to estimate. I mean, we'd have to do some more work on the cost, like the average cost of claims, which I don't have before me today.
Representative.
Thank you, Madam Chairman. Sir, so it sounds like since there is no coverage and if there were an incident where a dispatcher suffered from some sort of post-traumatic stress from a traumatizing incident or so forth, since they're not covered, I suspect that they're using their private insurance. Has there been any communication between your agency and Wyoming Association of Chiefs, Sheriffs and Chiefs of Police as to whether or not there's a gap? I don't know how. I would assume that every agency offers health insurance, but are there dispatchers that are going without? Is it an actual problem where they're not receiving treatment or able to access care?
Madam Chairman, Representative, I think that's a great question. I don't have a real clear answer for that. I would suspect as you that they're using their private health care for that coverage. And I mean, I think the issue is being that if the work caused the mental trauma, then why isn't the, employer on the hook for it, so to speak? So, but again, we'd have to talk with some more folks to see if there is truly a gap in that coverage, because I'm just not sure.
And Deputy Director, I have one more question then. Are we seeing that, because some people are receiving the mental health coverage and some aren't, and I know it's been a topic of conversation because things are traumatizing sometimes, but with the other ones that are covered, does that usually mean that they can stay on the job getting these services? Does that help keep them there, or is there any knowledge about what actually happens?
Madam Chairman, again, great question. I would say in the data that we looked at, it varies as to the degree of mental trauma. If they, you know, have to be put on leave or something to undergo treatment. I mean, in the data that I presented there in those 30 claims at the $63,000, that really, there are claims in there that have had lost time or lost wages, which is covered by workers' compensation. So I think it's just going to vary on the degree of trauma that they've suffered if they're missing work or not.
Thank you. Yes, Senator Scott.
Yeah, Madam Chairman, am I right in thinking that all these dispatchers are state and local government employees? Is that right, or are we reaching beyond state and local government?
Madam Chairman, Senator Scott, yes, to my knowledge, all the dispatchers are employed with the city, county, or town.
Madam Chairman,
Senator.
so what, the city, county, or town, am I right in thinking that the rates that are charged the employer here are basically based entirely on their experiences? And that they're a little different than the private sector that way. Is that right?
Madam Chairman, Senator Scott, yeah, so as you know, that we have a contracted actuary that goes through, and we do create base rates annually and look at, you know, the expenses of all the claims in the system. And yes, so all these claims would ultimately affect the experience rating of the particular city, county, or town.
Madam Chairman, it wasn't quite the question
Okay.
I asked. Let me ask it a different way. Is the procedure for cities, counties, and towns different from the private sector, where you do have a actuarial-based rate that does take claims into account? Do they pay the actual cost of the claims?
I see what you're saying. Sorry, Madam Chairman, Senator Scott. It is the actuarial process for determining the base rate is the exact same for private industry or public.
Okay. Madam Chairman?
Senator Scott,
Is,
follow up.
with the public, is the exclusive remedy provision in workers' comp useful to the public, or are they adequately covered in the Governmental Claims Act?
Madam Chairman, Senator Scott, yeah, anybody who's enrolled under Wyoming workers' compensation is entitled to the exclusive remedy as an employer. And I guess for those of you that don't know what the exclusive remedy is, that means that simply the employee can't sue the employer for their injury. That we are their exclusive remedy through workers' compensation.
Madam Chairman,
Yes.
that wasn't quite the question. Is the Governmental Claims Act such that that's not as important for the public employer?
Madam Chairman, I might ask, phone a friend.
Madam Chairman, Senator Scott, I can't answer that question. I don't know.
Yeah.
Ms. Dugan. Okay. Anyone else? Oh, Representative Thayer.
Thank you, Madam Chair. To Deputy Director Wolf, you know, this position, I know from actual being with a municipality for over 20 years, this position can be challenging to fill. We've talked about that, you know, they could use their private insurance or honestly out of pocket. You know, again, I would say a large majority are already on the city, town, or county's insurance. But do we have any knowledge that this is one of the reasons this position is hard to fill? You know, just a broad question.
Madam Chairman, Representative, I honestly I do not know an answer for that.
Thank you.
Okay. Right, anyone else? Okay, would you like to proceed?
Sure. I think, I think that's really all. At the end of the memo, again, again, this is a policy question for the legislature. If these people are included in the definition of emergency responder, if you all see fit to do so, I did include at the bottom of that memo some suggested language as to what we would want to do to include the emergency dispatchers in the definition of first responder so that they would be eligible then for the mental only claims. And with that, Madam Chairman, I don't really have anything further to present. I think there might be some people here that have other information on this.
Anything else, ladies? No.
Well, I think Senator Scott has one.
Madam Chairman,
Senator Scott?
ask the chairman a question. We heard that they're significantly over-reserved in terms of the fund versus the expected liabilities. Would a bill to have a general workers' compensation rate reduction be within the committee's charge from the Management Council?
Honestly, Senator Scott, I believe that if the committee wants to consider that, we certainly could. I don't know, LSO staff, do you have anything to say with that?
Let me pull up,
Madam Co-Chair?
yeah. Oh, right here. It was,
Madam Chairwoman, my only concern is I was actually just looking it up, but I don't know that we necessarily have a definition of public safety telecommunications worker anywhere in statute. We might need a definition of that, but other than that, I think that the amendment would probably be doable.
may I? Right. Senator Scott, would you, sorry, give me your question one more time. I want to make sure I
Madam
got
Chair,
it.
what I'm inquiring is could we sponsor a committee bill that was separate from this public service communications issue that lowered the workers' comp rates generally to get our reserves back in line with our expected liabilities and reduce the rates that employers were having to pay?
That's a,
And Madam Chairman, I think if the answer is yes, then I think we ought to draft such when we talk about things. If the answer is no, we ought to instruct the chairman to ask the Management Council for permission to look at that issue.
Representative Klauston?
Thank you, Madam Chair. So correct me if I'm wrong. I feel like 3 years ago, we did a 6% reduction and then 12%, and then we have a 15% reduction coming again. So we have been lowering the rates. Is that through legislative work, or is that something you guys are doing in your department?
Madam Chairman, Representative Klauston, so statute currently dictates that we have to do an annual actuarial analysis of the fund. We submit a report annually to this committee regarding those rates and the expenditures and what our reserves look like. To answer, I guess your question is, yes, we've done, I think, a total of the past 3 years, about a 33% base rate decrease. And then understand that those base rates can be, again, altered by an individual employer's experience, claims experience. Does that answer your question, Madam Chairman?
And Mr. Wolf, with these rate-based decreases, have they been through agency, through management council, through statute?
Madam Chairman, so yes, it is all done through statute in the current makeup of the statute that dictates that the agency work with an actuary to alter those rates annually. So does that answer your question?
Not exactly. So when you do that annually, then do you lower the rates automatically? Is that it? Or does the statute need to be changed to say it should be more or less?
Madam Chairman, so what the statute says is that it's based off the actuarial analysis, whether we raise or lower rates. We currently have the authority in statute to do that. If I might just a second say that we've done in the past, and I think Senator Scott's aware that we've in the past done what I would term as rate holidays. And so if that's something the legislature wants to look at, or you guys have authority to do that, we could certainly work with the actuary to do that.
Senator Scott, since you're familiar with that, what would you,
Madam Chairman, we have by statute lowered the rates, I think temporarily is what he means by a holiday. That's something we could clearly do if we feel the department is not adequately bringing the rates down when they could. You have to be very careful with the actuaries here. If you do that when you're not over reserved, you can get us in real trouble in a hurry. But it would be something we could do because, you know, those rates are being paid by employers and we clearly have to recover all the costs, but it sounds like we're doing a good deal more than that right now. So we could very well do it, or we could wait and see. We could produce a bill and then see what the department's going to do. Because it'll be this fall, will it not, to be that actuarial
Mr. Wolf?
reserve?
Yeah, Mr. Chairman, Madam Chairman, Senator Scott, yes, we begin that work basically right now. And then we usually have our annual rate hearing sometime in October.
would you like to proceed with the bill and then take it into session? Is that what you're asking?
What I'm thinking is maybe this committee ought to draft a bill for consideration at the next meeting and the final meeting, and maybe we'll need it and maybe we won't.
Does anyone on the committee agree to proceed?
Madam Chairman. So,
Representative Yen.
thank you, Madam Chairman. Our priority number one, workers' comp, was we would hear testimony regarding workers' comp laws and develop a stronger understanding of the prevailing challenges to fulfill workers' comp benefits, and then we would consider amending the Workers' Comp Act to classify public safety communication workers as first responders. Not necessarily opposed to considering a rate reduction, but I think drafting a bill is maybe a little premature. If we have time at our next meeting, maybe figuring out what the actuarial analysis looks like, because I would like to know before we draft a bill what a rate reduction would even do. Rate holidays, I think, are safe and fine, but what I don't want to get into a situation is where we go too far and then we are no longer in a safe zone anymore, especially if for some reason we have an economic downturn. Because right now we have the benefit because in the last couple of years, everyone's funds have skyrocketed, not just the workers' comp funds. So all of that to say, Madam Chairman, is I would say let's get some more information in our next meeting before we draft a bill.
Thank you, Representative. Senator Hutchings.
Thank you, Madam Chair. I just wanted to say ditto on that one. Let's hold off. Thank you.
Madam Chair, I don't know how you want to handle us deciding what we're going to do for the next meeting.
I don't believe that it was a continuation on the next meeting, but we sure can do that. LSO, could we put that on for the next meeting? And then could you provide some more information for us? Would that work? I mean, is there information that you can provide for us?
Madam Chairman, yes, I probably the best information available is the annual actuarial analysis that we submit every November, I think, to this committee and LSO. So I'm sure LSO has access to that. They could distribute that last report to you from October. Short of that, I mean, I can work with our actuary if you need anything additional to that information.
I believe our last meeting is in October. Is that right?
Madam Chairwoman, we have a meeting in early October and then we have a meeting in mid-November, if I'm recalling correctly.
So would Mr. Wolf, would the report be available for that November?
Madam Chairman, possibly. I'd have to look at our dates. I think statutorily, we're mandated to submit the report by November 1st, but don't quote me on that.
Madam Co-Chair.
Thank you. What, would you guys have any preliminary information by the beginning of October on this?
Madam Chairman, yeah, I think we certainly could, Senator Britton.
That's,
And just to be clear, as to rate reduction or rate holiday, is that what you need more information on? Sorry.
I know your report isn't due until like November 1st. Our next meeting would be, is it early October? Would you have any maybe preliminary data for us as far as where you would possibly be in November, knowing you wouldn't have anything final, but would you have more information than today, I guess, to be able to share with us?
Madam Chairman, Senator Brennan, yeah, so we should have some information from the actuary as to, and I just want to make sure I'm understanding, as to whether the rates are going up or down in the next analysis. Okay, yeah, we should have some information actually by the end of September on that.
And I
Okay.
believe, Deputy Director, I believe that the idea behind it is just to say, okay, are we continuing to go up when we really don't need to? Is there, since it is up to your purview, is that being considered?
Yep.
And I believe we just heard that it has gone down a few times.
Madam Chairman, yes, the rates over the past 3 years the base rates have reduced about 33.5%. So.
Okay, so we'll be able to get more information by then if you would. Okay, thank you. Representative Thayer, did you have another question? Please proceed.
Thank you, Madam Chair. Deputy Director, I don't want to put the cart before the horse, but with this potential rate reduction or holiday is new verbiage to me. And then also getting back to the item on our agenda, which is possibly adding the public safety telecommunication workers. It makes me a little nervous that, if this committee would want to move forward with this amendment, how that would actually affect your analysis that you'd be getting.
So Madam Chairman, Representative, yeah, I think that's a valid concern as to how many claims of these would be filed and how much it would cost the employers, if I'm understanding you correctly. Certainly, that is a possibility. I would just point to the data that we have thus far over the past 3 years. In the grand scheme of things, not a lot of claims, not a lot of money.
Follow up?
Yes, Representative.
Thank you, Madam Chairman. And in no means by my last point am I not in support for this possible amendment. I'm just making sure we're aware of all the situations that, if we talk about a rate reduction or a holiday, but then we're bringing on a new 350 new employees, how that will affect the actuary analysis. Thank you.
Deputy Director, all things considered, does that make sense?
Yes,
Okay.
Madam Chairman.
So would you, how would it work? When would be a good time to have this on our agenda just for an update?
Madam Chairman, I forget the date of your October meeting. I would hope we have something by then, but maybe just to be safe, you put us on the November agenda.
Senator Scott?
We need to have a look at it in the early October meeting, because that's when we'll decide to draft a bill. And then once we have the November data, then we can decide what the final figure ought to be.
And just a point of clarification, Senator, are you saying you would like to look at the information and drafting a bill in October?
I'd like to
If-
draft a bill
If
in
that's the way
October.
the committee wants to go?
I think we ought to draft it, be prepared to authorize a bill draft in October based on the information that's available then. And if nothing else, if they'll tell me the size of the surplus, which they have, and the total workers' comp premium for the year, we can come up with a number as to how far we can go. But we shouldn't put the bill in final until November. But we need in November, we need a vehicle. Because if we put off the bill drafting to November, we won't have a final product to look at that November meeting.
And I would just ask, is this something that the committee needs to vote on?
Madam Chairwoman, you can just do a voice vote.
A voice vote?
If you do a voice vote, I think that'd be fine. You don't have to do a roll call vote.
Okay, thank you. Committee, all in favor of moving information and a bill to the October meeting for a potential bill filing in November, please give a voice vote of aye.
Aye.
Anyone opposed to that? Nay. Okay, we'll proceed. Okay, is that clear?
Madam Chairman, yes, I think so.
Okay,
So-
if not, please give us a call.
Sure.
Okay, thank you.
Madam Chair?
Sir,
Madam-
yes, Senator Hutchings.
Thank you. I don't know if I missed this in the conversation, but I would assume, and I don't know if this is a good idea or not, but when they do their analysis, they could do a normal one and then do an analysis adding the 350 employees to kind of get an idea how that's going to look as well. Is that something that's already been talked about? Just wondering if he can do both to give us an idea on the numbers.
Thank you, Senator. Director Wolf.
Yeah, Madam Chairman, Senator Hutchings, I can certainly work with our actuary to see if they can come up with any type of potential added costs that these 350 people might add. So,
Well, Senator Scott.
It'd be very unlikely to get would be more than an aspect of decision that would be more greater road rate. Sounds like the costs would be, in that scale, it's just gonna be trivial.
Madam Chairman, Senator Scott, you're exactly right. I mean, the cost, like I said, of these 30 claims that we've thus far had is, in the grand scheme of things, when we're talking billions of dollars, $60,000 is just not a lot of money.
Thank you. Okay. So is there any other questions for the Deputy Director of the department? Finished? Okay, I believe the Weisskopf was online. Is that for this conversation? Well, it must be. Okay, thank you very much.
Madam Chairman.
Representative Yin.
So Madam Chairman, since we have a bill draft for a rate reduction, I'd also like to move for a bill draft to amend in the dispatchers
Very good.
as well.
Do I hear a second on that motion?
Second.
All in favor of moving the,
Madam Chairman,
yes,
ought we not to hear from hear if there's any more public testimony on this bill before we vote on any bill drafts on
good
it?
idea, good idea. Okay, online? Public comment online? Okay,
Madam Chair, I'll offer commentary if you'll allow it.
please. And who am I speaking with?
My name is Monty McLean, and
Okay,
I
thank you.
represent the Wyoming chapter of APCO and NENA, a membership organization for emergency telecommunicators here in Wyoming. I also run the 911 center in Cody, and I've been the supervisor for 21 years. I know Senator Scott had asked about fiscal implications. In that time frame, in 21 years, I have had 6 employees who have left my center because of the mental stresses involved in the job. This is a very difficult job. There is no decompression or downtime in between calls for service, and it is cumulative and it does build. I had one employee who did have to seek assistance. We did it through peer support. They had to pay for it out of their own pocket because of the insurance plan, high deductible. You know, they basically paid everything out of pocket. Insurance didn't really come into play. So it is something that does happen. Do I see it significantly? No. Is it a tool in the toolbox to assist us with retention of employees? Yes. I also work as an instructor at the Law Enforcement Academy. I teach the communications basic curriculum, and I am teaching 30 to 50 employees every calendar year as we are replacing people across the state. The average life expectancy, so to speak, of a telecommunications worker nationwide right now is a little over 5 years. In 5 years, they end up burned out, they end up leaving. Any tool that we can use that can help us with retention and making sure that the good employees stay would be a benefit to the state of Wyoming. And it doesn't matter where you work or anywhere across. Again, 350 of us. And in 20 years, I've had 6. We might be looking, at 5 in a year statewide.
11, 20, you're going to be.
Thank you for that. Any questions
That's 236 Main Street.
for Mr. McLean? Thank you, Mr. McLean. And then the next person on there, Mr. Thompson?
Thank you, Madam Chair. My name is Alan Thompson. I'm the Executive Director of WASCOP, the Wyoming Association of Sheriffs and Chiefs of Police. And we've been aware of this, I guess it's a gap. I would call it a gap that tends to differentiate those communication officers from the peace officers and detention officers and the correction officers, the firefighters, the search and rescue personnel that are all able to receive services through the bill from 2020, yet their partners in the communication realm are not able to. Based on some of the comments or questions that we heard earlier today, I would like to point out that we see a relatively low number of around $67,000 expended so far for services for those other groups that qualify for this. And And I think that we hope to see that maybe increase as the stigma related to mental health treatment becomes less and less of that stigma. And I would say that one of the fears that we have right now with communication officers is they're not already allowed to have these services. So if they ask for these services or go out on their own and get mental health services, there's also that fear of reprisal for employment action against them. I think as employers and employees working together to provide services to help people get through these difficult times should be fair and equal across the board. And I feel that by adding those communication officers, the fairness is definitely needed, and also it should not cost a lot in the long run. So I would say it's probably just something that was overlooked at the time that bill was passed, on the impact that this could have on those on the other end of the radio and the other end of the phone line. There is the language that was presented in there, talked about telecommunication workers. The Wyoming statute actually defines them through the term dispatchers. So in 91701, they're referred to as dispatchers and defined. When we see that language throughout the rest of the statute, that's not the actual predominant language in the industry right now, because it's their job entails much more than just dispatching people. So they are telecommunication workers. And if you're looking at a definition, maybe that maybe look at working on that correct title. They are post-certified in the state of Wyoming, just like peace officers, detention officers, correction officers. And I think we had some good testimony from Mr. McLean about the turnover impact. Just to point out that that's his information from his agency. WASCOT does not collect that data on employment actions from the 80-some members that we have, so we wouldn't have a statewide impact data point that we could provide to you. But I think if we looked at the supervisors of each of those peace apps, you would hear these similar stories from them, because that's the stories that we hear. And I really appreciate the opportunity for you to discuss this and think about it today. I'd be happy to answer any questions if you have any for me.
Thank you, Mr. Thompson. Just a quick question. We have here that the Workers' Compensation Act, specifically the statute 2714-102A, defines first responder as peace officer, employee who is employed or volunteers as firefighter, search and rescue, or ambulance. So basically, you're saying that these have been put into statute, and now we're asking for the addition of the emergency dispatchers. Is that correct?
Madam Chair, yes. And if you were referring to my previous statements about the definition of dispatcher, that was just in response to an LSO question. But yes, that is what we'd ask you to consider, is adding that public safety telecommunication worker or dispatcher, however it's defined, to that subsection. I guess it'd be what, Romanet 31, first responder means a peace officer, employee who is employed or volunteers as a firefighter, search and rescue personnel, telecommunications workers, or ambulance personnel. So adding them to that list that already exists in the statute.
Thank you. Senator Hutchings.
Thank you, Madam Chair. Mr. Thompson, on the nomenclature, when I look at emergency dispatchers, I'm just wondering, and the words public safety telecommunications, telecommunicators, could there in any way be any other group of people that would fall under that category outside of what we are really wanting to gear this change to, as just the emergency dispatchers? There's no one else out there, maybe someone working on a pole somewhere. Hey, I'm a public safety telecommunicator. I fall under this too. Does that make sense to you? Is it just the dispatchers and nobody else?
Madam Chair,
Yes, Mr.
to answer the
Thompson.
good senator's question, I mean, I would leave that to LSO's determination on how best. I think the people, the dispatcher is defined as government employees that do a certain job. So as long as we tailor that definition to fit those government employees, I think that's something that they would probably have better language to suggest that. I don't think this loops in other unintended folks into that possible definition that I'm aware of.
Thank you. Any other questions or comments? Representative Rodriguez-Williams.
Thank you, Madam Chairman. Thank you, Mr. Thompson, for your testimony. I'm looking at the 2020 draft that was handed out by the department. And I would say it's probably a little outdated. I'm interested in proposing that LSO do a little more research as to how this potential legislation would compare to language that's been adopted in other states. So in this previous draft, they throw in there 36 months as a kind of a threshold. And it also states, in no event shall any disability benefit for a compensable mental injury under this subdivision extend more than 36 months beyond the diagnosis of a compensable injury. So I don't know that that's, I don't want to say reasonable, but I know it does take some time, having worked in the field, to get into treatment. And so sometimes care goes beyond outpatient. Sometimes it leads to inpatient, post-traumatic stress retreats, that sort of thing, that are provided for first responders and law enforcement. So I'm interested in learning more as we mold this bill, so to say, if there really needs to be that limit set on there. And then I appreciate the question from the good senator about other positions. I'm curious how other agencies or other states handle positions such as community service officers, evidence techs, other folks that are working in the field and might encounter a situation, perhaps the situation that wasn't closed, so to say. So just curious if you would be open to that.
Mr. Thompson.
Thank you, Madam Chair and Representative. I appreciate that kind of a deeper dive into this and making sure we get it right. Along those lines, I would add that the aggregate buildup is it might not be the term. That's what we talk about it in law enforcement circles, is a series of minor incidents, if left unattended over a long period of time, tend to evoke mental health responses similar to a very high stress and intense situation one time. So as you talk about that 36-month limit, I think that is something that might need some further discussion, because if we are aggregating over an entire career, we want to make sure that we're providing people with the services that they need from day one through retirement. And I would agree with that. There was another point. We talk about, for lack of a better word, broadening the folks that would be in this realm. What is a first responder in Wyoming? Well, there are other groups out there that you might want to consider in addition to the communication. I don't want to turn this into a discussion that it's not, but you might want to talk with the Coroners Association and the impact that those cases that they work, I would consider to be very similar to what first responders. And rather than maybe that first responder terminology, maybe it's those government workers who are slated with these responses to catastrophic incidents, or not necessarily catastrophic, but whatever the definition is, and it would cover those. So thank you, Madam Chair.
Thank you, Mr. Thompson. Anyone else? Okay, I think that's online. We have some public comment here. Would you please give your name and what you have to present?
Hi, I'm Tanya Mills. I represent the City of Newcastle, Town of Upton, and Weston County Combined Communications. I am the interim director. I've been there for 21 years. I would just like to put a little bit of input in for this. I have personally paid for therapy due to a couple of very traumatic situations. I believe that we should be looped in with the officers and that we may not see the trauma, but we do hear it on the phone. Sorry. We do hear it on the phone, and then there's no closure. Unless they call for a coroner, we never know. So then we sit on that trauma, and it built. That's all I have. Thank you.
Thank you very much, and thank you for the job that you do. Yes, sir. Oh, I'm sorry, just a moment. Any questions for, and I'm sorry, I have Tony. May I have your, Tanya? Tanya,
It's Tanya Mills, Madam Chair.
thank you, Ms. Mills. Questions?
Yeah.
Representative Yin?
Madam Chairman, thank you. Ms. Mills, apologies for making the motion before you guys were able to testify. I think understanding who was available to testify was my mistake. Appreciate you testifying. The 36 months issue, do you understand what that's talking about? Do you think that we need to change that number to extend it, or what are your thoughts?
Ms. Mills?
When I went to therapy, I had 4 sessions with the therapist, and it helped immensely. I do believe that 36 months is a good timeline to help with the trauma. Typically, I don't get this emotional when speaking about it. I'm going to say it's nerves. But I think that 36 months is a good point.
Thank you. And I was just wondering, do you think that there is a hesitancy for people in this position that go through trauma in their line of work, that there is a hesitancy for them to seek out help?
Thank you, Madam Chair. Yes, I do. It took me, I want to say probably 4 months, 5 months after the trauma to seek out help. My family caught the worst of it. I wasn't sleeping. I wasn't eating. When I did sleep, I was having nightmares. So it's very significant.
Thank you. Anyone else? Representative Gugemas?
Thank you, Madam Chair. I'm just curious, is there any kind of, when you're getting trained for this position, is there any kind of pre-training on how to deal with any kind of stressful situation that would help alleviate future circumstances?
Ms. Mills?
Thank you, Madam Chair and Representative. I believe that they do train us. We go through the academy. There is stress training. They give us ways to help alleviate the stress. It depends on the trauma. If you'd like, I can explain the major trauma that sent me to therapy. I don't know that they give us necessarily enough tools in that toolbox
to potentially deal with everything we deal with on a daily basis. Coming from a small community, it's your friends, your family, your neighbors that you're dealing with when they pass or they get in vehicle accidents or whatever happens. So it's people that you know personally all the time.
Representative Rodriguez-Williams.
Thank you, Madam Chairman. Ma'am, thank you for sharing your story and for your bravery to come before us. So Representative Gugumas talked about pre-training or alert, so to say. What about post-vention? So like, are dispatchers in your agency included in debriefings after a traumatic situation that officers might have endured and you were on duty that night or that day?
Ms. Mills.
Thank you, Madam Chairman and Representative. We are included in some of the debriefings if they feel it's a traumatic enough event for us to be included. They don't always remember to include us. Like I said, I can give you some of the details of the trauma that I had. A young man shot himself in the face, and I got to listen to his mother screaming at him and then him gurgling in the background. Luckily enough on that one, he did survive. But the trauma that I got with what I heard on the phone, and then there was no debriefing because it was the ambulance crew, the officer, and me, and that was it that was involved. So there was no actual debrief on that call. Every time the bathtub drained after that, the gurgle would bring back that trauma. Like I said, it was nightmares and the whole 9 yards. So it does take a toll on anybody that works there.
Thank you. Yes, Representative Wasserberger.
Thank you, Madam Chair. Thank you for coming and sharing your testimony with us today, Ms. Tanya. I'm just wondering, when you finally decided to go get help, was it a decision you were able to make on your own, or did you have a support group that encouraged you to go do so? And like, is there a training for that when people like recognize that to encourage them to go seek help? I know when I used to lifeguard, there was times where, yeah, they would train us on things like that to notice that if somebody needs to go get help after a really tough incident. And sorry, I know this is probably a tough personal question, but.
Ms. Mills.
Thank you, Madam Chair and Representative. My family pushed me more so than the agency. I think the agency noticed the changes, but I don't think that my supervisor at the time knew exactly what to do to help. Like I said, I did go to 4 counseling sessions. I did pay for those out of pocket on my own. The agency did say that we do have some extra funds or whatever to send, but they only will pay for 2 therapy sessions. I do, as a supervisor now, watch my employees very carefully. And if I see that something is very traumatic, or I listen to the calls and say, okay, well, this is like a very traumatic call. Do you want to go talk to somebody? Do you need to go talk to somebody? We can make the funds available. So I do, try to help as much as I can with my employees.
Thank you for sharing.
Okay. I was just going to say, Ms. Mills, that was one of my questions, if there was agency training, like as supervisors, if you get trainings to look, because while you're doing that for the people that you work with, you just wonder around the state or around the nation if it's a new conversation and it's a new thing that's coming out, I know, for people to get that support. So do you know if there is supervisory training?
Thank you, Madam Chairman. I'm not sure if there's supervisory training. They do have, I know Campbell County has a CISM. It's a crisis management incident team that consists of, they basically run it like a debrief. They go in and they just make sure that everybody after the trauma is okay. But it has ministers and therapists and some of the higher ups in the agencies that go in and do that.
Thank you. Okay. Anyone else have questions for Ms. Mills? No? Thank you very much for coming today, and we appreciate your testimony and your work.
Thank you, Madam Chairman.
Yes, sir.
Madam Chairman, members of the committee, my name is Chuck Trimble. I'm the dispatch program manager for the Highway Patrol. I've been in public safety communications in Wyoming for 26 years. 18 of those years were in 911. I personally myself have listened to a woman be shot to death by her estranged husband while I was on the phone. I have listened to, and some of these are difficult to get through. I had a man call in to report his own suicide and then shot himself while he was on the phone with me. I have been in the dispatch center where my coworkers have listened to a man burn alive in his truck because he couldn't get out. I've had telecommunicators sit there and listen to a woman be sexually assaulted for 15 minutes while waiting for officers to arrive. I've listened to, helped another dispatcher who had a deputy that was in a running gun battle and had no idea where he was, and we couldn't get back up to him. So the trauma is real on the other side of the phone. There's no doubt about it. And to some of the comments about attrition in the dispatch centers because of this trauma, absolutely. I have seen it every year that I have been in this business. It is cumulative. As Mr. McLean said earlier, there's no break in the dispatch center. An officer goes to one call and then he'll do his paperwork and then he goes to another call and then maybe he goes to lunch. A dispatcher will sit there and answer the phone, handle a traffic accident, go to the next call and handle a suicide, go to the next call and deliver a baby, and go to the next call, and who knows what that's going to be. And there's no decompression time in between that. And that's cumulative. And let alone over a 12-hour shift. You do that then for 3 years, 5 years, and it takes a physical toll as well as a mental toll on the telecommunicator's health. It's very important. This topic is, to me, the wellness of my telecommunicators has always been the top of my list. We do have critical incident stress management that will do a debrief afterwards and make sure everybody's doing okay. We do have a peer support team, and I have dispatchers that are on that team and keep an eye on the people in the room. My supervisors specifically get training on what to look for in their people if they're getting stressed, but that's the first line of defense. That's just so that we can get them off of the radio or get them off of the phone so that they don't become a further hazard to themselves or to somebody else. After that, it's out of our hands other than making sure that they're okay. And we stop by and see them, but I have had to pay for therapy out of my own pocket. I've had to burn my own personal time to go seek therapy and to get treatment. I actually sought therapy because I was self-medicating and realized that I had a problem. So I took myself and went in and got help. And some of that did require time away from work where I had to burn my own PTO to do so because it's not covered. So this is very important to me. As a state employee, I can't lobby for it, but I can tell you this would be a huge benefit for all the telecommunicators statewide. And it's a long time coming. And I'll stand for any questions.
Thank you, Mr. Trumbull. Any questions? Representative McCann.
Thank you, Madam Chair. I'd like to go back to kind of the academy stuff. Do they teach you guys? I mean, I hear they give you some coping mechanisms, but coming from a military background in the upper echelons, in those upper echelons, I mean, do those guys get PTSD? Yes, they do. But the incidence is a lot lower than in the conventional units. And I think a lot of it has to do with what we call selection. If you're in selection, you take, you know, and you're getting more and more stressed throughout for like 4 weeks. It's about 4 weeks total. You never know how long it's going to be. But over that time frame, you take the MMPI 4 different times, and it's people just kind of disappear. Okay, and what, you know, that's the Minnesota multiphasic, whatever it is. It's a psych test. Do they do any of that type of stuff to kind of, well, we call it weeding out?
Madam
Just
Chair.
you know, and it's not, and I don't mean that in a derogatory sense. I mean it in the fact that they've gotten very good at figuring out what type of people are susceptible to this. So I'm just wondering if you guys get any of that type of training.
Madam
Mr.
Chair,
Trumbull.
Representative, there is training available. There is, what I forget what they call it, stress management that is available through the academy. There are some advanced level classes that are available throughout the year through various training outlets. Whether or not an agency can send somebody really depends on their staffing. We're all low staffed, and depends on the training dollars. And typically the guys with the guns and the badges get more training dollars than the people with the headset. So, and that's, take that as you will, but I have a burr under my saddle about that because I think we need just as much training as the guys with the guns, but that's just the way it works out. And we have to do psychological pre-testing before we hire anybody. Unfortunately, that washes a lot of pre-service people out, or previous service people out. I've had a lot of EMTs that wanted to be dispatchers, probably would have been excellent dispatchers, but they still had PTSD from their job. And because of the stress requirements of our job, were deemed ineligible for employment.
Mr. Trumbull, thank you. Do you know, is there any follow-up or data or idea about people that may leave this type of position and where they are in a year or 2 or 3 or 5?
Madam Chair, I can tell you from personal experience, we have lost 5 in the last year. 3 of them specifically denoted that the cumulative stress was a reason or a contributing factor that they no longer wanted to do the job. And I think they're all working in retail now.
Thank you.
I don't know that that's any better, but
Some days. Thank you. Any other questions for Mr. Trumbull? Thank you so much for being here.
thank you, Madam
Appreciate
Chair.
it. Yes, ma'am.
Thank you for having me here today. My name is Amy Payne. I am the Training and Compliance Coordinator for the Laramie County Combined Communications Center in Cheyenne. I started my dispatch career in December of 2012. I promoted to supervisor in 2017, and I sacrificed my career by moving into my current position January of 2025. In the last 13 and a half years, I've been a trainer. I've done quality assurance and critical incident review. I'm a terminal agency coordinator for the National Criminal Information Center. I've also helped develop and implement our public education, morale, and peer support teams. And I currently serve on several liaison boards. One is the Wyoming Law Enforcement Academy's communication boards, as well as working with our IT, GIS departments, law enforcement, and fire chiefs associations. The effort in reclassifying 911 telecommunicators under a protective service is deeply personal to me, as it lays the groundwork for addressing the increasing challenges faced in our industry. My experiences are not unique to me, as you've heard from the prior speakers today, as well as any other 911 professionals. We have trauma that we experience every single day. To this day, I can still hear the screams of a mother giving her address over and over as her husband stabbed her, their 2 children under the age of 5, and her father. That was before he left their house and then stepped out onto the interstate, where I took another phone call from the woman who hit him. I also carry the guilt of having argued with an 87-year-old woman over the phone when she shot herself. She called 911 because she wasn't dying quickly enough, and I wanted her to grab any sort of cloth or towel to try to stop the bleeding so that she would live, and she just wanted to die. Her last moments in this world were me arguing with her. And finally, I think about my safety every single day as I have been threatened over the phone numerous times. But the one that stays with me the most is an individual who told me that he would put a bullet through my head because he did not like the way that a Cheyenne police officer was talking to an individual on a YouTube live stream. When I reported the incident, I was told to take comfort in the fact that he doesn't know what I look like, he only knows what my voice sounds like. These examples are important because they talk about the psychological burdens that we face every single day, but they are not the only burdens we have being 911 dispatchers. As small departments or agencies, we are the very last to be told anything if we're told anything at all. As previously mentioned, we are not often followed up with unless it makes the news. As small departments, we also work between the extremes of broken and outdated equipment, as well as brand new equipment that appears because technology is changing every single day. And we have very little training, and we are generally only asked how it impacts our workload after it has been implemented. Dispatchers also carry the weight of criticism on every split-second decision that they make during high-stress situations with limited amounts of information. From my own experience, a prior mayor of Cheyenne told the community that I needlessly panicked them before they ever stopped to talk to our director about the decision that was made and what information dispatch had at that time. And recently, our center has experienced a blatantly incorrect news article based off of a social media post made by a completely separate agency. When we asked to have our human resources and county commissioners defend the people in our center, we were told that it was more important to restore the community's faith in our technology than correct the incorrect information about the people that staff our center. Our center has also been asked by these same people why dispatch centers across the state of Wyoming and the United States are struggling. And the answer is our most valuable resource. Our people are undertrained, overworked, rarely recognized, and we are all understaffed. It's difficult to effectively train dispatchers when it often requires them to work more than a 12-hour shift or come in on their day off. In being overworked, I used to wear my statistics like a badge of honor. I have worked 27 12-hour shifts in a row. I've worked 96 hours in a single week. I've worked a 27-hour shift straight during a snowstorm, and I can sit at a dispatch console for 12 hours without ever getting up to take a break. And our recognition is often in the form of baked goods after being left off of official declarations of recognition while being told to our faces, I could never do your job. And finally, the recruitment of people. It's really hard to bring in people to a job when you're working nights, weekends, holidays, you're missing your family events, and you speak to people on the worst day of their life over and over for the same amount of pay and benefits as a dental receptionist or a car wash manager. And career advancement in some instances means giving up the benefits as a dispatcher. As I mentioned at the beginning of my speech, I sacrificed my career in January of 2025, and that is when I promoted into my role of training and compliance coordinator. I was advised at that time that my position no longer fit the law enforcement retirement system that I was in as a dispatcher, even though my counterparts in other agencies, especially law enforcement and fire department training sergeants and officers, get to keep theirs. Since I work in a public safety center and answer 911 calls, my job was no longer law enforcement related. My time is split between law enforcement, fire, and emergency medical dispatch, which disqualifies me from that retirement. Again, this is not just me. Our operations manager and quality assurance supervisor stepped into the same realities when they accepted their position. The new badge of honor that I now wear is that I still commit my time to this job. I live with PTSD every day. I'm also expected to maintain all of my certifications and step into any position in the dispatch center during an emergency with no notice. For a job that is often referred to as the first responder in emergency services, we have failed our dispatchers as they are the first person to be left behind. Reclassifying telecommunicators with public safety professionals is a critical step into building a foundation of resilience within our profession. It'll formally recognize the realities of the work and create the opportunity to meaningfully address some of the long-term impacts, including burnout, compassion fatigue, and the mental health challenges. When we invest in and in support our most valuable resources, we strengthen the entire system, creating resilient centers that are better equipped to serve our communities and the first responders that rely on them. Thank you for your time.
Thank you, Ms. Payne. There's a lot to unwrap in that. So many different ideas, and I thank you very much. Anyone? Representative Wasserberger.
Thank you, Madam Chair. Ms. Payne, thank you for coming and sharing your testimony today. That's a lot to deal with, it sounds like. I'm just curious, what have you done to handle your job like up to this day? I mean, I imagine I would imagine I'd have to do some breathing exercises or something to stick with that. What did you do to stay so strong?
Ms. Payne.
So being a dispatcher has been my calling in life. I have thought many times, I've been asked by my family, including my husband and my son, to leave my job. And I have not done it because it is so incredibly important in our community. And it's something that the majority of people don't know that's there. And so I have stayed because I want to be the person that can help build up the people that answer these calls, the people that work in law enforcement. I also come from a first responder family. My aunt and uncle, as well as my brother, are all in law enforcement. And so I understand the critical role that dispatch plays in their safety and the safety of our community.
So, thank you. Senator Crum.
Thank you, Madam Chairman. First of all, all three of you, and I'm sure there's others in the room, thank you for what you do. We couldn't be here without you guys, so thank you for what you do. Feel really bad for what's going on here. If there were 3 or 4 things that you could change right now, what recommendations would you make to make the situation better?
The first is what this committee here today is for, is to help dispatchers access mental health services. I will say I'm incredibly lucky that I'm in Cheyenne and we have a lot of services. As I have spoken with and trained dispatchers throughout the state, those services are very hard to come by. You also have to reach out to people within your community that then question whether you still have the mental ability to be able to do the job and meet the needs of the job. The other thing would be to support the NG 911 legislation as it goes through. As I talked about technology, when your technology doesn't work in the middle of a situation, it's incredibly frustrating because you know that you can always do better and that the person's life on the other end of the phone matters on the systems, matters on the equipment that we have to respond to it.
Thank you.
Thank you, Ms. Payne. Representative Yin.
Madam Chairman, Ms. Payne, and maybe this also could be a question if Mr. Thompson wants to answer it. So when we had the American Rescue Plan, we put up $1 million specifically for law enforcement mental health support grants. I think that helped fund a conference last year. Has it been useful? Do you know, and again, this is why I also directed to Mr. Thompson, is it something where it has actually been useful to support not just those first responders, but you as the communications folks as well?
Ms. Payne.
Yes, it's always helpful. So one, to get the training, but it also helps us build connections within other communities and reach out. One of the things that has been most difficult, especially when seeking mental health, is you don't want the people around you questioning your ability. But when we can get together and have honest conversations and share those similar experiences and how we've made it through, it makes it easier to reach out for that help.
Thank you. Mr. Thompson, did you have anything to add?
Thank you, Madam Chair. There's various grants and programs going on across the state. A lot of them focus on delivering mental health services to the public that we serve. But part of like the grant that WASCOP has right now for virtual crisis care has a component of peer support for the members of the agencies in there. The opportunities for mental health first aid and CIT training across the state. There's components of the individual wellness in those courses, even though a lot of those are dedicated to the mental health of the public that we serve. And then there was a question earlier about some pre-hire requirements, and certified communications officers, detention officers, and peace officers are, by post rules, are required to be free of any physical, emotional, or mental condition which might adversely affect the applicant's performance of duty. And that's tested through, evaluated by a licensed psychologist or psychiatrist, and then a licensed physician, PA, or nurse practitioner. And those are all pre-hire requirements. So they have the same standards that the other components of post have.
Thank you, Mr. Thompson. And I have a quick question for you. While we see and have heard that there is preliminary testing to make sure of someone's ability to handle a stressful job, because we wouldn't want to put them under a lot of stress if they're already stressed. So I understand that. But I've also heard that I have two questions. One, will the dispatch be covered under the programs that you're talking about? And two, is there conversations between the sheriff's departments, the fire departments? Well, you might not know about fire department, but the sheriff's department and the dispatch offices in making that conversation available to understanding the different aspects of the different positions?
So, Madam Chair, the first question about could you restate that first question? I want to make sure I get it right.
Yes.
About the dispatch ongoing?
With the programs that you said were offered, is dispatch included in those programs?
Yeah, Madam Chair, yes. So like the CIT reimbursement grant that we offer, that is specific to dispatch, detention, and peace officers. A lot of that depends on the organizational makeup and the decision of the local leadership. Some of our dispatch centers across the state of Wyoming are part of a joint powers board that's made up of those law enforcement leaders and other community members on that joint powers board. Some rest under a police department, some rest under a sheriff's office. The Highway Patrol dispatch, while not a 911 center, is a dispatch center that rests under the Highway Patrol. So you have various levels of local and state level law enforcement supervising or part of the board or coordinating with them. So it's kind of there's probably 32 different specific makeups of that across the state of Wyoming. And then the communication part of it, that once again rests with that local leadership. So in my experience, I worked for a PD and then a sheriff's office, and the dispatch center rested under the police department. So obviously that relationship was a little bit closer because they were housed in the same location. They saw each other physically walking down the hallways in the building, whereas that was a little bit separated at the sheriff's office when they were in a different building, and you didn't talk to them and see them other than through the radio. So it just depends on the locations across the state of Wyoming.
Thank you, Mr. Thompson. So from what I'm hearing from you, there is great potential for a gap to be there.
Yeah, Madam Chair, I'm not sure that it's a gap. I mean, it just depends on, local relationships and local makeup of where that dispatch center rests within the local community. I think, do we all have room for improvement every day? Yeah, absolutely. I think that we could all improve our relationships with other entities that we serve alongside.
Thank you, Mr. Thompson. Is there any other questions or comments? Ms. Payne, thank you very much for your testimony and your time. Okay. Yes, ma'am.
Pride moment because that is my training and compliance coordinator right there. I began my career as a communications officer in 2002 and currently serve as the director of the Laramie County Combined Communications Center in Cheyenne, Wyoming. Over the course of more than 2 decades in public safety communications, I have answered emergency calls involving officer-involved shootings, suicides, domestic violence, child deaths, structure fires, pursuits, cardiac arrests, line of duty deaths, and mass casualty incidents. And yet, despite being the first voice the public hears during an emergency, telecommunicators across this country are still federally classified as clerical workers, not first responders, not emergency professionals, clerical workers. That classification is outdated, inaccurate, and harmful. When a mother calls because her baby is not breathing, and I have taken that phone call, the telecommunicator does not simply just answer the phone. We identify the emergency, calm the caller, provide life-saving medical instructions, coordinate responders, relay critical safety information, monitor radio traffic, track scene developments, and often remain connected to the caller through the most traumatic moments of their lives. And I've had the benefit of working in centers with several employees. There are centers where that is all one person doing all of those things. Before a police officer arrives, before a firefighter turns the corner, before an ambulance reaches the address, we're there. Telecommunicators are the first responders. Every major public safety system in the country depends on us functioning at the highest level under relentless pressure. We are trained in emergency medical dispatch, crisis communication, incident command systems, law enforcement databases, responder safety protocols, and critical incident management. In my own career, I have supervised communications operations during officer-involved shootings, all of those same incidents mentioned before, catastrophic infrastructure failures, and large-scale emergencies. I've watched dispatchers continue taking calls while silently grieving the loss of officers they personally knew. I've seen telecommunicators coach CPR over the phone while hearing family members scream in the background. I've watched a trainee of my own handle her own mother's cardiac arrest situation while getting help dispatched. I've watched them hold composure during chaos so responders in the field could stay safe and focused. I'm sure you've heard radio traffic where the officers are frantic and screaming. We're the calm voice in that storm. However, one experience forever changed me. In 2019, Officer Dale Woods, who had previously been a dispatcher in the center I was then employed, was struck and critically injured in an auto accident while on duty. Many of our dispatchers knew him personally. Some have worked alongside him before he became a police officer. That night, my team still had 41 other communities depending on us while we simultaneously managed the emotional trauma unfolding in real time. We coordinated emergency responses, monitored changing conditions, supported our staff, and continued operations without pause. No one in that room would call those dispatchers clerical because trauma does not care about job title. The psychological impact on telecommunicators is profound. Studies consistently show high rates of PTSD, anxiety, depression, and burnout within emergency communication centers. In just the past 3 months, 7 dispatchers nationwide have taken their lives by suicide. Anxiety, depression, and burnout within emergency communication centers continue to rise.
Telecommunicators absorb trauma hour after hour through a headset, often without closure and without the recognition afforded to the other emergency personnel. I can tell you, when we had our officer-involved auto accident that was fatal, that police department was able to call on their surrounding departments for backup and help. They were handling those incidents coming in for that department. We did not have that luxury. We were still taking the calls, still processing incoming emergencies for those other communities. As the consequences of this federal misclassification extend beyond symbolism, it impacts access to mental health resources. It affects retirement systems and benefits, as Amy mentioned previously. It affects recruitment and retention during a nationwide staffing crisis, so much so that APCO is now having an annual staffing crisis summit so that different leaders across the country can brainstorm ideas on how to get people past the psychological evaluations and then keep them. Meanwhile, the expectations placed upon them continue to grow. Today's communications professionals manage text to 911 calls, integrated emergency systems, crisis negotiations, active shooter incidents, interoperability systems, emergency medical dispatch protocols, and increasingly complex technological platforms. In Hamilton County, Ohio, we were among the first major metropolitan areas in the nation to implement text to 911 technology, and I helped train personnel and educate agencies on its use. Today, as a communications center director, I continue leading modernization efforts, including the Smart 911 implementation, infrastructure upgrades, peer support programs, and responder wellness initiatives. Telecommunicators are no longer switchboard operators as they were from decades past. They're highly trained emergency communications professionals performing mission-critical public safety work every second of every day. We all have an opportunity to correct a longstanding injustice by formally recognizing telecommunicators for what they already are. First responders. This is not about prestige. It is about accuracy. It is about priority. It is about acknowledging the reality of modern emergency responses in America. Every single emergency begins with communication. When citizens dial 911, they're not calling a clerical office. They're calling for help, and the person who answers that call begins the emergency response immediately. And our public expects them to be fully trained and capable. I ask you today to stand behind the men and women behind the headset, recognize their service, recognize their trauma, recognize their professionalism, recognize their role in saving lives, and finally recognize telecommunicators as first responders. Thank you for your time.
Thank you, Ms. Young. Very, very informative, and I appreciate it. Any questions or comments for Ms. Young? I don't see any. Thank you very much. Hey, welcome, and please just introduce yourselves and tell us what you have to say.
Madam Chairman, my name is Jason Bagger, and today I'm representing the Wyoming Association of Municipalities. And there's been a lot of really great touching comments today, so no need to repeat a lot of what has been said. But joined with me today is Mayor of Thermopolis, Adam Entenson, and the Mayor of Orland, Rebecca George. And they'd like to share a little bit about their perspective as leaders of their communities.
Hey, Ms. George.
Hello, everybody. Thank you for your time today. You guys have spent the last few days talking stuff. I know we're on the last end of it, but we do appreciate the work and effort that you guys put into this.
Ms. George, please come through the chair.
Oh, sorry, ma'am. Again, thank you. I'm here on behalf of the city of Orland and also Washakie County Sheriff's Office. When this conversation started at our WAM regional meeting in February, actually, we started talking about this interim topic, that this would be someplace that we would like to start. And I went to our police chief and I went to our sheriff's office in Moreland and Washakie County. Everything with, mayors and stuff, we deal with budgets as well. So I had a lot of those questions when we first started this conversation. And in Washakie County, we actually share the dispatch center and the jail, but we split those costs 50-50. And so that is the budgetary aspects of that. With the first responders, the dispatchers that we're discussing with this amendment right here, the rate at which the county pays for workers' compensation is that 1.69%. They do that for all of their employees except for the clerical, but they do pay for that full rate for the first responders that we do have. With that though, with that full rate, sorry, they're not actually getting that mental health pathway. And so for me, it's like, well, if we're paying the full rate, we should get all of the benefits with that. And so that's where this conversation ties in to actually add that language and amend the first responder definition so that we can actually get the full benefits for the full rate that the county and hence is shared with the city is actually paying for. With that, I don't have much more to say, but I do have a statement from our sheriff. May I?
Ms. George, yes.
Thank you. So this is from Sheriff Austin Brookwell. He serves as the sheriff of Washakie County. He is writing in support of the proposed amendment to include public safety telecommunications workers within the definition of first responders under Wyoming Statute 27-14-102 for the purposes of mental health coverage under workers' compensation. Public safety dispatchers are often the very first point of contact during someone's worst day. They are responsible for answering calls involving suicides, overdoses, domestic violence, serious scratches, child abuse, death, assaults, and other traumatic incidences. While they may not physically respond to the scene, they are hearing those emergencies unfold in real time and are responsible for the managing critical information while providing direction and support to deputies, officers, firefighters, EMS personnel, and the public. In many rural communities like ours, dispatchers are not simply call takers. They are a critical part of the emergency response system and are often exposed to repeated trauma over the course of their careers. The emotional and psychological impact of this work is real and should be recognized the same way we recognize the impact on law enforcement officers, firefighters, EMS personnel, and search and rescue responders. This proposed change is not about creating special treatment. It is about acknowledging the reality of the profession and ensuring that men and women who serve as public safety telecommunications workers have access to the mental health resources they may need as a result of the work they perform on behalf of the public. Our dispatchers are expected to remain calm, professional, and composed regardless of the situation they are handling. They carry an immense amount of responsibility and stress, often without recognition from the public. Supporting this legislation is one way we can acknowledge their role and help ensure that they are not left behind when it comes to mental health support. I respectfully ask for your consideration in support of this amendment, Sheriff Austin Brookwell, Washakie County Sheriff's Office. And that's all I
Okay.
have. Thank you.
Mayor George,
Yes.
right? Yes. Okay. Any questions or comments for Mayor George? Okay. Thank you for being here. Appreciate it. Okay. And you're the mayor of Thermopolis?
Guilty as charged, Madam
Yes.
Chair.
Okay.
My name is Adam Estenson, and I'm the mayor of Thermopolis. And thank you all, Madam Chair, and your committee for hearing this today. I know you've all been doing good work here for the last few days, so I'll be brief. I don't know that we need a lot more convincing, but I am here to advocate for my frontline people. In the community of Thermopolis, we as the town, through our police department, take care of dispatch for all of Hot Springs County. And on 12-hour shifts, it is the norm for one person to be sitting in the interior of our law enforcement center, running all of emergency services throughout our entire county. And that story plays out throughout the whole state. We heard today there's 350 fellow Wyomingites that sit down in front of a computer, a phone, or a radio in a dispatch center, whether it's municipal, county, tribal, or state facilities. The phone does not ring because people are having a good day. We've obviously heard stories. Sorry. My people experience that daily. And, you know, from talking a parent through CPR on their own child, to hearing a child's panic voice on the phone, the part that really hits home to me is that, you know what they do next is pick up the next call. And in my 3.5 years as mayor of Thermopolis, I have seen 2 seasoned dispatchers that had to leave the profession because of buildup and tough calls. we did what we could as a community to support them. My full-time job is Director of Risk Management for a trucking company out of Thermopolis. So I know workers' compensation, I know how it works. And when we attempted to get that help through workers' compensation, that's where this particular journey started for me, for my people. And so I think this pathway to mental health through defining them as the first responders that they are, is a great way for us to show up for those people that show up for us. So with that, I thank you for your time, Madam Chair, and I would stand for any questions.
Thank you, Mayor Estison.
Yep.
Okay, thank you. Any questions or comments for the mayor? Just a blanket comment. I am so glad for everyone that I was here today and testifying. To get the conversation started is definitely the first step. Because a lot of times people are living in situations where they feel so alone and nothing moves until we get involved. So your being here today has started that. So thank you for that. Yes, sir. Anything else?
Madam Chairman, I will, I guess, just leave it as what the mayor said, and WAM will certainly participate any way we can to help with definitions and work through the legislation.
Okay. Do, Mr. Weimer?
Baker.
I'm sorry,
Baker.
Baker? Oh,
Yeah.
Baker, okay. Mr. Baker, do you share this type of information with your members?
Madam Chair, I would have to get back. I'm just contract helping with Director Hartstreet on this, so I would say that I do not have the best handle on the inner workings of WAM. I know there's extensive things beyond just the forward-facing things that, you see with the legislature, but, they do a lot of compliance and training support for members, but I couldn't tell you specifically.
Well, we might
What they do.
mention to Director Harpstra to get that on her agenda.
Okay.
Okay, thank you. Yes, ma'am.
Madam Chair, if I may, I can kind of answer that question. Recently, WAM has gone through regional meetings, different areas around the state. We're in Region 3. We talked about this issue specifically 2 weeks ago. And so I can imagine that they're probably discussing all the interim topics and the committees that are coming up in every region. That's an assumption. I know it was talked about in hours for sure, just 2 weeks ago. So my answer to that question would be yes.
Thank you, Mayor George. Yes, okay. Any other comments or questions? Nope. Thank you very much. Is there any other public comment on this issue? Share space. I guess so. Okay, Representative Campbell, good to see you today. Thanks for coming to see us.
Thank you, Madam Chairman, Co-Chairman, and committee. We're going to ask that we extend the conversation. So far today, the conversation is about, the definitions and who is included in terms of coverage in workers' comp, whether it's insurance or that extended piece of mental behavioral health. What we would ask of the committee in terms of those definitions under 27-14-102, the part of that statute that we're talking about is who is included in the definition of first responder. And right now, that goes from firefighters, law enforcement, all of those, and excludes our public safety communications. What I would also like to draw your attention to is under that Romanet 31, the definition of first responder. And we've talked about right now who's included in that definition. Why we are here is because who is not included in that definition, and that is our volunteer ski patrol, who we have. So what we would ask is that you also consider in your amendment adding volunteer ski patrol. Right now, in that definition, it covers volunteer firefighters, it covers volunteer search and rescue, and it covers volunteer ambulance. It does not include our volunteer ski patrol. And what is happening, because they are excluded from that definition, is, I mean, our volunteer ski patrol are often also our search and rescue. They are also our emergency medical providers. But because they're not explicitly named, they are not afforded that coverage. And so what happens is our municipalities have to purchase separate coverage outside of that for our volunteer ski patrol. So in addition to adding our public service telecommunications officers, we would also ask that you consider and add our volunteer ski patrol. And I have with me from our City of Casper, Director of Parks and Rec, and some of our volunteer firefighters, it's been a long day. Our volunteer ski patrol, who would also like to speak with you, if that's okay.
Yes, Representative, I have a question for you right off.
Mhm.
You said that they have to be covered under a separate policy. Is that for insurance? Are you looking at workman's comp?
Workers' comp.
Workers' comp.
I think so.
Okay, well then
Mhm.
we'll just hear what you have to say then.
Mhm.
Okay.
And I failed at the very beginning to say I was Elisa Campbell, House District 56.
And through the chair.
Thank you, ma'am.
Okay.
There we go. Thank you. I'm Bill DeGrave. I am the Director of Casper Mountain Ski Patrol, and thank you very much for the consideration of adding volunteer ski patrollers to the definition of first responders. Today with me is Mark Bauer. Mark is a past Director of Casper Mountain Ski Patrol.
Excuse me, could you give me your name again and go
Yes.
through the chair, please?
Yes, sorry. Thank you. My name is Bill DeGrave,
Thank you.
Director of Casper Mountain Ski Patrol. Okay. Thank you, Madam Chair.
Okay.
Although Mark and I represent Casper Mountain Ski Patrol, we do appreciate that positive vote on this matter would include all volunteer ski patrollers across the state of Wyoming. So really, thank you for that. We are 45 volunteer patrollers at Casper Mountain. Volunteerism is fairly common among ski areas, especially small ski areas, and particularly in Wyoming. We spent a lot of the last 2 hours talking about mental trauma. And although when I prepared, I was thinking more of physical trauma and injury to our patrollers, but I want to start with mental trauma and maybe capture that before we move on to some of the others. In 2010, Ogadon Ski Area suffered a very unfortunate double fatality. You may remember that, but a snowboarder was coming down the hill, collided with a 5-year-old girl and her mother. The snowboarder and the 5-year-old died in that accident, and the mother is permanently injured. A lot of our patrollers who patrol today were involved in that accident, not only the first response, but also the subsequent trauma that resulted from it. Many of them had to leave patrol because of the trauma they faced. And those that are with us still today still remember that event and do still have trauma. So I just want to make sure that I enforce that mental trauma and mental wellness is very important to our ski patrol, and it's also a very real event in what we do. So I'll continue on with my prepared statements. We work directly with the city employees to provide a safe skiing experience for the visitors. We place signage, fencing, we repair obstacles and hazards, and just make sure that the area is generally safe for everyone who comes up to enjoy it. We provide emergency care when it's needed and transport and transfer to a higher level of care when it's needed. Most of our patrollers have significant medical experience. Some of them are even in that industry for their jobs. During our volunteer activity, we get exposed to the same risks as paid employees who we work side by side. Slips, trips, falls, falling objects, collisions, constantly moving parts, and constantly stationary parts that people impact.
During our volunteer activity, we encounter patient injuries on a regular basis, ranging from sprains to the severe. Each year at our area, up to 6 patients leave our area either in an ambulance or in a helicopter. That puts our service at a very high level of care, essential and very much appreciated by the customers who are up there. If volunteer ski patrol did not exist, it's very likely that most of Wyoming's ski areas may not as well. Last year was a slim year for snow. Nevertheless, our volunteer patrollers served 75 operating days and over 3,200 hours of service. Several patrollers put in over 20 days of volunteer service. Speaking of injuries, in 2024, we saved a life. We're very proud of this. When a skier suffered a heart attack at the top of one of our hills and ended up at the bottom, did not know how he got there. With the help of immediate bystanders, and then by ski patrol, we shocked this patient multiple times, transported him to the waiting helicopter, while a patroller was straddling him, applying compressions. He survived the event, underwent heart surgery, and supports the skiing programs at Hogan to this day, a very successful outcome. We do also suffer patroller injuries, both physical and mental, as I mentioned. I personally took a fall in the winter of 2025 and had to have physical therapy to repair a sprained shoulder. Another patroller took a slip that same year, fell on his thumb, pronated it, and had to have surgery to repair his thumb. Yet another fell this year and strained his back. My colleague, Mark, may tell you about his event from a few years ago when he has a minute, when I give it to him. So most patrollers have personal insurance. Not all do. Further, it'll be very helpful to have workman's comp availability so that this volunteer activity, which we love, does not become a financial burden to the volunteers. To cap off, we also provide our services to other community events. We love to volunteer. We volunteer at Winter Last Blast, which is an opportunity on Hogadon or on the Casper Mountain, held each spring and allows kids to experience winter sports. We volunteer at the Casper Marathon and provide first aid response there, and the obstacle course event that's held at Hogadon. We are indeed first responders, and we're trained basically to the same level as an EMT. We offer skills that are needed at the ski areas, and we patrol because we enjoy it. Wyoming is a winter sport state. Skiing, boarding, they're all important elements of that mixture. Thank you for your strong consideration of this proposal, and you'll be making a positive outcome. I'll turn it over to Mark.
Thank you, Bill. Madam Chairman, committee, my name is Mark Bauer. I'm a Marine Corps veteran. I'm a retired firefighter from the city of Casper, and I've worked fire and EMS for a total of about 25 years. When I retired from the fire department, I said I would never do this work again. And then somebody talked me into being a volunteer patroller. And I've enjoyed it for the last 17 years. So it's been a good thing. With Ski Patrol, the work we do is everything that Bill mentioned, but the work we do is actually very similar to what the EMTs and paramedics do. Although the environment that we work in is different than the environment they work in on a general basis. Our environment's uncontrolled, it's cold and windy. The surface we work on is never level or flat. It's steep, it's icy, it's snow covered. It's an unsteady terrain, so it's not stable. We are in the middle of it with slick boards on our feet. When you attempt to lift an injured guest, there's a whole new set of dynamics. It's tough duty, guys. Personal injury is somewhere in my thought. Most of the time while I'm patrolling, safety is always our priority. As I age, I find it is harder to heal. Bill mentioned that I had an accident many years ago, doing sweeps, end of the day, hit a soft spot in the snow, my ski stuck, I kept going, landed flat, tore the shoulder out. I worked with the city of Casper, I worked with risk management and our patrol to get that taken care of. No injuries since, thankfully. One more page and then I'll be finished. Half a page, quarter of a page. In closing, Myself and our patrol and my patrol friends and colleagues, we enjoy patrolling, we like skiing, and we like being able to help people that need help. It's a rewarding opportunity for us. So definitely, we appreciate your consideration in the matters discussed. Thank you.
Okay, Mr. Bauer, any questions or comments from Mr. Bauer? I have a question. Are you a volunteer as well?
Yes, ma'am.
And are you paid?
Not at all.
So workman's comp would work through. Okay, you're going to answer all those?
Through the
things?
city of Casper.
We've got a person here that's, yeah, okay.
And Salima helped tremendously when I was injured last time.
Okay,
So I always appreciate that.
Thank you.
Thank
Yes,
you,
ma'am.
Chairman, Committee. I am Zalima Lopez. I'm the Parks, Recreation, and Public Facilities Director for the City of Casper. And so currently under state statute, volunteers that are covered by workers' compensation, and this is primarily for physical injury, would be firefighters, search and rescue personnel, which I would argue these folks are, law enforcement personnel, search pilots, mine rescue workers, ambulance personnel, hazardous substance workers, emergency management agency personnel, game and fish volunteers, and law enforcement aides. So those are specifically bulleted in the list of volunteer personnel that would qualify for workers' comp coverage. Again, it is my opinion that our volunteer ski patrollers do act as first responders to a similar degree that our search and rescue personnel do, that our ambulance personnel do. They're providing immediate medical care for those in need until higher level assistance can arrive to take them off the mountain and provide additional care. And so as you all are having this very important conversation about modifying statute 2714, we were hoping that we could at least have your consideration in expanding those definitions to include these first responders as well.
Okay, thank you, Ms. Lopez. Any questions or comments?
Madam Chairman.
Representative Yin.
Madam Chairman, thank you. Mr. DeGrave and Mr. Bauer, have you spoken to any ski patrollers in any other ski hill in Wyoming about this?
Madam Chairman, we have not spoken to any of the other patrols in the area about this topic. We know that we're representing them, and many of those do have volunteer patrollers as well, and I believe they're in the same circumstance as we are, that they're not covered under anything but their own insurance policies.
Representative Yin. Okay, thank you very much for that. Any other questions or comments? Senator Hutchings.
Thank you, Madam Chair. Just a quick question if Mr. Wolf is still in the room, if he has any comments on this and what this may do to his actuarial analysis for October. Thank you.
Madam Chair, Jason Wolf with the Department of Workforce Services. Yeah, so I think this gets kind of complex, but as is stated up here, the definition of an employee typically doesn't include any volunteer unless it's the ones that fall under this list that was just discussed. So under statute 2714-108, and that list includes firefighters, performing rescue work. I just lost it here. Yeah, specifically volunteers to whom this act applies are firefighters while fighting fires and doing firefighting work, search and rescue personnel, and volunteers working on projects for Game and Fish Commission. So there would, in order to include these volunteers that are ski patrol, that statute would have to be amended to include them as the specifically enumerated volunteers under 2714-108E.
Representative Yin.
Madam Chairman, thank you. So Mr. Wolf, are the paid ski patrollers at Jackson Hole or Targhee, are they already covered under workman's comp?
Madam Chairman, yeah, they should be.
Representative Clouston.
Thank you, Madam Chair. And Mr. Wolf, I guess one of my questions is if we add to the definition of first responder, what other commitments or obligations does the state have? Can we keep it, this discussion has really been specifically to the mental health, right? Now this seems to be expanding that to physical and mental injuries maybe, but I mean, what other commitments come with expanding that definition?
So if we're talking about just adding volunteer ski patrol to, again, if you're talking about adding that so that they're covered as a volunteer, that's one thing. And then adding them also to the definition of the first responder, then if they're added to that definition of first responder, they would be eligible for the mental health care without a physical injury.
Follow-up, Rest.
Thank you, Madam Chair.
Alston.
Thank you. And are there other benefits that I guess we haven't really talked about if now that they would be covered or, I mean, I wonder what some of the downstream effects are of this as we add people to our list.
Sure. Madam Chairman, Representative Clouston, yeah, I think anytime we're adding a subset of folks to the compensation system, they then become eligible for, medical treatment for their injury, lost wages if they have to miss work. And then, of course, if they're a first responder and fit that definition, the mental health care. That answers your question.
Thank you. Senator Crum.
Thank you, Madam Chair. Question, how are rural fire department volunteers and EMS people, where are they classified in far as the workman comp issue as far as mental health?
So, Madam Chairman, Senator Crum, they would qualify for the mental health because they are a designated first responder under that 2714-108 statute that I mentioned.
That's what I thought. Thank you.
Any other questions or comments? Senator Scott.
Probably have enough differences in the what's going on here that this is a second bill in addition to the one on the mental health issue. And I think one of the issues we're going to have to explore with this one is to what extent, when you look at the other ski areas around the state, is the ski patrol formally organized? How informal is it? How much difficulty are we going to have identifying who really is eligible and under what circumstances? I think it's enough different that we're really talking about two bills here, Madam Chairman. We could conceivably add them together at the end, but I think we better look at them separately.
Committee? Okay. Yes.
Madam Chairman, Senator Scott, thank you for that. I will just say that all of the volunteer ski patrols in Wyoming are structured under the National Ski Patrol System, which gives us a consistent means of training, consistent mean of care. And yeah, all of it is structured under the National Ski Patrol System. Thank you.
That helps.
Representative McCann.
Thank you, Madam Chair. The question I come up with is, since you're volunteers, you're not getting paid for this. So is it just injury compensation? Where does the line get drawn as far as what's taken care of? As far as if you're volunteering, you're not getting paid. I don't think we are obligated to pay, a work comp salary. Where does it end?
Okay.
Madam Chair, Representative McCain, The compensation that we would consider appropriate is just that medical and mental trauma that might exist from our service to the community. No lost wages.
So,
Mr.
Madam
Wolf?
Chairman, I would just add to that, that if they're included as a volunteer, just kind of a little bit of understanding, how we charge premium in relation to a volunteer is we impute a wage. That is basically, we say, maybe they earn $150 a month or whatever, to charge premium. So the premium that we charge isn't all that much. But if they're included under that, and if they're injured to a point where they, they're missing time from this volunteer job, but they also have a day job, we could be obligated to pay them a lost wage for that job too, just for complete transparency.
Co-Chair Brennan.
Thank you, Madam Chair. Do we have an idea about how many volunteer ski patrol there are in the state currently? How many people we'd be looking at adding?
Bill and I talked about this before the meeting, and we're both thinking right around 130, 140. There's several small areas in the state. There's Hogadon, there's Meadowlark, there's Antelope Butte. There's some volunteer patrollers in Laramie that are mixed with the paid patrollers. And I'm sure there's probably some of that at some of the bigger areas also. I don't have a good number other than our estimate.
Follow up? Okay, any other comments? Thank you for being here today. Appreciate it. Okay, any other public testimony? Okay, committee, what's your pleasure?
Madam Chairman.
Senator Scott?
Madam Chairman, I ask that the chairman carry both the bill on the mental health issue that we heard about earlier and this bill on these volunteers as separate bills forward to the next meeting.
Committee? Yes? Oh, okay, thank you, Representative McMahon. Okay, committee? Yes. All in favor? Aye. All opposed? Okay, LSO, do you need any clarifying on that? Okay, so they'll be ready for the next meeting? Okay, thank you. All right. Yes, Representative.
Thank you, Madam Chairman. I would just move that the committee receive a memo or semi-research to us about other states' versions of the mental health bill. So in other words, narrowing in on the 36-month provision, and then also what other positions are included in that when it comes to first responders. To serve as a comparison.
I would,
Thank you, Representative. Yes.
I would
Mhm.
second that and think that that's a good idea.
Yeah. Give us a lot of backup. Okay, any questions?
Madam Chairman,
Senator Scott?
I think it's a good idea, but the committee needs to understand that Wyoming is one of 3 or 4 states where workers' comp is a state monopoly. And there's some very, very sound state constitutional reasons that that's true, but that will affect the comparison with other states. They're under a little bit of a different type of system.
Senator Scott, thank you. So I'm sure you were aware? Yes, okay. All right, thank you. Anything else that we need to bring up, committee? Representative Wasserberger?
I guess just a quick question as we're wrapping things up. Would this be the time to speak up on bills that we're going to draw for the next meeting, or is that something we do next meeting? And how does that work?
Yes.
Okay.
Yes, this would be the time.
Okay, well, I'd like to do a draft bill for the Expanding Physician Access Act from the lady that was testifying earlier on that. And I would also like us to do a committee bill draft on the SNAP benefits waiver, a redraft of the SNAP benefits waiver request that we had this year as well.
That,
So I guess I've got a motion for those two bills.
Mm.
Is that?
Yes.
Madam
Hannah.
Chairwoman, would you mind taking both of those one at a time?
Yes.
Thank you.
Okay.
So I need to make a motion for both of them?
Yes.
Okay. Thank you for clarifying. So.
Thank you for coming. Okay.
So Madam Chair, I'd like to make a motion that we do a redraft bill of the SNAP benefits waiver request. And then I can say I'd like to make a motion again.
Okay, just a moment.
Madam Co-Chair.
Senator Brennan.
Thank
Okay.
you.
Yes.
Thank you, Madam Chair. I, appreciate the desire to bring forward the SNAP request, but I don't believe that that is within the purview of what this committee has requested from Management Council for this year. So I think that that would be outside of the purview of this committee, this interim.
LSO, is that permissible to bring a bill that is not within our agenda? I believe that I have heard that done before.
Madam Chairwoman, it has been done before. It's usually not advisable, but it's been done. It's more, it's chairman prerogative, I'd say.
Okay. Senator Scott.
First, I would say, I can't, I don't understand what the bill request is, so I'm having trouble on that score. If the committee really wants to bring something that's outside the charge, then it's appropriate for the committee chairman to ask Management Council, particularly at this first meeting, to broaden the charge. I don't understand what the bill request is. I'm unable to follow what it is he's talking about.
And I would just ask LSO, if I was to bring it before Management Council, would that be a conversation through you, through email, through a telephone call right now? What would that be?
Chairman Ottman, the way we've handled this in the past is we would draft a letter, have you sign off on it, and we'd send it to Management Council. That's typically the way it's done this time of year.
Okay. Chairman Brennan, did you have something to say? Okay, Senator Crum, thank you.
Well, yeah, I do
Mhm.
quickly. Just for Senator Scott, what we're talking about is a resurrection or redraft of last year's SNAP benefit waiver bill that was, I believe, sponsored by the committee, but did not make it through the entire legislative process.
Restricted soft drinks from being eligible for SNAP. Okay.
Correct.
Okay. And committee, if I may, I would urge the committee to give the chairman some discretion here. If they think that that's getting us into more areas than we ought to get into, I think we ought to support them, because that bill in particular could perfectly well be a private bill.
And Madam Chairwoman,
Hannah?
can I add something?
Sure.
So so in March of 2026, Governor Gordon actually signed an executive order to get a waiver from the USDA regarding certain items being purchased on SNAP. And apparently that was approved by the USDA. So I don't necessarily know that we need a bill at this point, but that's up to the committee.
Do you have a response to that, Representative?
Thank you, Madam Chair. Yeah, it was restricted for soda and candy, and the way we had it originally drafted was for accessory food. So I think, some of the messaging from folks I talked to that were in contact with the White House was they were very impressed with that bill, and so I just think that'd be worthwhile for our consideration. I know it was commented earlier that we're the unhealthiest state in the country, and so I think that we should look into that and explore that conversation a little bit further.
Representative Yin.
Madam Chairman, I think if the chairman both want to present to Management Council to get this on their interim topic list, you guys should take the prerogative and do that, but you should decide. Otherwise, if we're just gonna pass bills willy-nilly that aren't on the interim topic list, we don't need to have an interim topic list. And frankly, that's kind of what I argued for in Management Council, because we do have committees that are going out of their interim topics, pretty far out of their interim topics. But we only have limited time. And so the question is, do we want to focus on the priorities that we already put in our interim topic list? Or are we going to go outside of our interim topic and then ask Management Council for that? And then maybe if we still want to capture all of our interim topics as well, we would have to ask them for more days. My suggestion is just, this could easily be a personal bill. It actually doesn't need to be a bill at all because it's already been done. But if the representative wants to bring it, I would just argue that he should bring it as a personal bill next year.
And Representative Yin, when you say it's already been done, could you clarify that for me?
Madam Chairman, so what Ms. Johnson has said is true, which is we already have a SNAP waiver being requested to CMS for candy and sugary drinks. So that was the basis of the bill last year. The accessory foods got added as an amendment at the last meeting of our interim, but the core was sugary foods and drinks, and that has happened.
Chairman Brennan.
Thank you, Madam Chairman. I just want to echo that. That's why this did not, part of why this did not make it onto our interim topic list. It was not high on the priority overall of the committee. There has been executive, this is being done and implemented at the executive level through the governor's request for the waiver. And the Department of Family Services has been working diligently on putting those things in place currently. So I think if this is something that some members are interested in bringing a bill, I do think that this is a great personal bill, but it's not on our interim topic priority list. And I would really like to, see us sticking to what is on our interim topics and what we went before the Management Council to request.
So it was submitted as, co-chair, it was submitted as a possible topic.
Madam Chair, I am not sure that if it was put in on our list of possible topics when we had our meetings, but I do know that it was not submitted to Management Council for an interim topic. So it's not been approved by Management Council as an interim topic.
Madam Chairwoman, it looks like it was suggested as an interim topic, but the committee chose not to take it up. So.
Okay. Would it be possible to see where that bill is with the governor's office and the Department of Family Services? And just to see how far we've gone with that and if there's potential of something passing?
What else?
It's on the educating how staff works. It's not this.
Okay. Madam Chairwoman, yes, we can look into that. We can write a short memo or an email out to the committee as soon as we figure it out. I'm pretty sure it's already been approved by the USDA, but we have to just double check on that.
Okay. Representative Osterberger, would you give us that time for the next meeting?
Yeah, I could certainly do that. Yeah, that'd be fine.
Okay. Co-chair, is that all right with you? Okay. We would like to proceed that way. Thank you. Representative Rodriguez-Williams.
Thank you, Madam Chair. If we're ready to move on with
Yes.
additional
Yes.
ideas. On the topic of rural transformation, there were several suggestions that were proposed to us by Department of Health. Obviously, not a lot of homework was done or research with some of the stakeholders that are involved. We heard from a few today. I would like to encourage the committee to consider inviting a few folks to the table at our next meeting to provide input. One being the community colleges that offer the dental hygiene programs. Two, whoever, and I don't know who this is, but on the topic of nutrition, when it comes to continuing education, medical education for providers, hearing from whoever that might be, I don't know who exactly that would be, but whatever realm that would fall under, I would encourage some representation at the next meeting for that. And then also the university from the School of Pharmacy, whether they Zoom in or attend. I think just having some feedback as well from them as well.
Thank you, Representative. With the second one, with the continue some nutrition information, I believe the university in the School of Medicine, they have like one class or 1 hour of nutrition. Could we get some information on who does that and what that class entails and possibly why it's only an hour? And would you, Representative, would there be additional information that you want on top of that?
Madam Chairman, according to my notes from Department of Health, it was nutrition continuing medical education. So perhaps just LSO reaching out to Department of Health to see what exactly that would look like on the surface if we were to consider adopting that for additional funding through the rural transformation program.
Is that clear?
Yes, Madam Chairwoman, we'll just reach out to the Department of Health and figure that out.
Okay, thank you. Senator Scott.
On that one, I think one of the things we're going to need to consider if we get into that particular area has been very given to fads. And there's, I think, considerable question on the scientific basis for some of the that are advocated in that area. And that would be something we need to explore if we're going to get into that in legislation.
Okay.
Madam Chair?
Yes, Senator Crum.
Yeah, on the school pharmacy, I would recommend we invite Dean Kim Kruger or somebody like that to come and really inform us of what they're doing and what their thoughts are on that whole pharmacy issue. And I'm sure the dean would be probably more than happy to come.
Okay, and that was Dean Kruger.
Kruger.
Okay.
Madam Chair.
Yes.
Thank you. I do definitely think bringing LCCC, I think looking into, I think maybe Casper College is getting ready to start some dental hygiene. I think that that's not, a bad place to get some from them, and the School of Pharmacy. On the nutrition piece, I know that yesterday we asked the department, actually on all of these, for suggestions that they had where maybe we would be leaving federal dollars. I know we did ask them to follow up with how much we're leaving on the table with this. I think we asked them one other question, but I know that the Department of Health is going to be getting back to us with some information on what exactly it would be that we would be leaving on the table if we don't make statutory changes. So just want to remind the committee of that.
Okay, any questions from LSO? Is everything pretty?
Yes, Madam Chairwoman, we have everything so far. I was wondering if Representative Wasserberger was going to make his other motion or if I can leave that off.
Representative Wasserberger.
Madam Chair, thank you so much. I'd like to also make a motion that if we could do a draft for the Expanding Physician Access Act. And just, I guess, similar to, the same one that we had, that I ran this year. If we would like to add some suggestions to it, I know, I believe it was Miss Sheila Bush was speaking earlier about having a list of countries on there. And I know we've had that conversation that there's more friendly countries just besides that list. But I mean, maybe that would be something to talk about in the next meeting as well, whether we have that list or not. I know Arizona does that. And so, I mean, maybe the consistency makes sense and maybe not, but I mean, be something worth having a conversation about. But sorry, I gave you a word salad. So yeah, just for now, a redraft of the bill that I had this year of the Expanding Physician Access Act.
Okay, all right, it's seconded. So with your word salad, was that including the information on certain countries being included in that or not included?
So just redraft it as is for now. Maybe that'd be a conversation to have on the countries when we have our next meeting, but just to keep it simple, easy for LSO, we'll just have it drafted the way I originally had it, so.
Okay, and okay, so Senator Crum.
Yes, Madam Chair. Are we talking about, for you guys from the House, I don't know, but House Bill 129, is that what we're discussing?
Yes.
Yeah, okay, I would agree with that then too.
Okay. Yes, Representative Ross. Yes.
Thank you, Madam Chairman. One of the things that stood out to me was when Ms. Bush talked about the WWAMI program and some of the things that she mentioned, just a few that hold back eligibility into the program. She mentioned that there was one situation where a college student had an ID at one point from another state, and so that prohibited the student from eligibility in the future. So I guess I don't want to create a whole lot of work for LSO. I don't know whether or not this looks like a research paper that is provided to us that discloses some of the most common uneligibility items that they encounter, or if it's having them come before the committee and share that directly. Perhaps a first step might be the paper. I'm open to ideas. I would love to hear them.
Madam,
what the barriers are.
Chairman, could I, a point of order? I believe we have a motion on the table right now regarding a possible bill draft. If we could maybe for
yes.
International physicians, maybe we could finish up and take a vote on that first, if we don't.
Okay, we have the introduction and the second. All in favor of redraft? Oh, did you?
Yeah, I have something on the, like, um, comment, question, maybe a motion, like a friendly amendment on that redraft. I do think that we heard, that it has about maybe looking and starting with certain countries. I would actually ask that instead of just starting with last year's draft, that we would start with that in the draft. If that would be, because I think that will come up as a conversation, and I think that that would be a great place to start with the draft.
Madam Chair.
Representative
Okay.
Osterberger.
Thank you very much, Madam Chair, and Abby, and I'm so sorry, Senator Brennan. In most cases, I would agree, very friendly. I guess I'm being too nice. I don't want to put more work on LSO than what they're already doing, so if we could just hold it off till next meeting, I think that'd be okay.
Chairman Brennan.
Madam Chairman, if I might, I would actually like to start there because we've got a lot more time between now and the second meeting than we do the second and the third meeting. And so I actually think that's friendlier for LSO is what I'm hoping, because then if we went down that road, like if we start there, then at least they have more time to do that research. And so that's why I would prefer to put that in the draft now, look at those things, and then maybe, but at least that language has already been worked on.
Madam Chair. Thank you. I guess instead of us going back and forth on it, maybe we should just ask LSO how you feel on, would it be easier to just work on a next meeting, or is it not too much to ask to do it right now before the meeting, or?
Madam Chairwoman, Representative Wasserberger, I'm not sure how much work would go into it. I think we just have to find other countries that have similar standards to what we have here and add those in. But like Senator Brennan said, we do have about 3 months before the next meeting. So that does give us, I think we'd have enough time to figure that out.
Okay, I'll see it as a friendly amendment.
Representative, thank you. And then we can always, we'll have that. Okay. All right. All in favor of the redrafting of House Bill 129 with the amendment to add foreign countries that are amenable, I guess, to our standards, please signify by saying aye.
Aye.
Those opposed, nay. Okay, I guess that's gone. Senator Scott.
Madam Chairman, let me suggest on that one, I think Sheila's got a list of those countries.
Yes.
That would make it a lot quicker.
Okay, did you get that on it, Ms. Bush? Okay. All right, and Representative Rodriguez Williams, your motion?
Thank you, Madam Chairman. I move that LSO provide a research paper to us through contacting the WWAMI program and compiling a list of the most common ineligible factors that occur for that program. And if they would like to come to our next meeting and provide feedback, anything further, I would encourage that.
Second? Oh, Representative Clausen.
Thank you, Madam Chair. So I think it's such a successful program, and I'd really like to learn more about it. So dealing with what the good representative said, but also I'd like some history on it. Like, when was it last updated? What problems do they see? Are there some changes that we need to make? So I think them coming into presenting to us, I think we could really kind of dive into the program, and I'd really like to learn more about it.
So Representative, are we suggesting that we would have a representative here from WWAMI?
Thank you, Madam Chair. Yeah, I would like them either to be here or at least be online where we could ask some questions. And, I think looking at what the representative had suggested is important, but I think there's other things in there that we could learn from.
Thank you for that. And I know we heard earlier today too, that there, even with the nursing profession, there are underlying elements oftentimes in standing in the way of progress with getting people into different programs or availability that we just don't know until we hear right from them. So that would be great. Is that good? Okay. Is that everything? Oh, we better vote on that, I guess. Do we have to vote on that? We have the second.
got it.
Okay, all in favor of that? Senator Scott.
No. Vote on this first.
Okay. Okay, all in favor of information and let me see, information about WWAMI, please signify by saying aye. Aye. All those opposed, nay. Okay, Senator Hutchings, did you have something earlier?
No, I was just going to mention what Anna mentioned, that Representative Wasserberger had kind of not mentioned his second request, but I'm all good. I'm all good. Thank you.
Thank you. Okay, Senator Scott.
Madam Chairman, and I do not want to make a motion out of this, but I want to urge the co-chairman to put on the agenda for next time. We had a major complaint in the behavioral health area, which is one of our topics, that the licensure board wasn't responding in a timely fashion to getting people cleared to work here, and we were losing potential candidates in quite a scale. I think we ought to have the licensure board, maybe the executive chairman and or the executive secretary and a member of the board come for us and talk about that issue. It is one we could legislate on in the scope of our assignment from Management Council. We wanted to. I would hope that just having them come in and explain and what they were doing to fix the problem would solve it. But I would urge us to put that on the agenda for next time,
Okay,
if you can fit it in.
going to be a full agenda, but yes, Anna.
Thank you, Madam Chairwoman. I'm sorry, which licensing board was this?
This is the Mental Health Professions Licensing Board.
Okay.
This specifically, the gentleman, I believe, is running the Gillette Youth Services, whatever they called it, was complaining about them and is seconded by the others.
Okay, thank you.
Okay, Chairman Brennan.
Thank you, Madam Chairman. I'd like to get a sense from the committee on where we would like to go with kind of the topic of pharmacists and their scope of practice, which is, I'm going to think of different wording so that we don't all get traumatized by those words. But I just want to get a sense of the feeling of where the committee is at on that, and if there's anybody, because I do believe that this one is a big topic that would best be suited for a working group. So my question is there any interest on the committee and any interest from people that would like a working group out of that?
Madam
Okay.
Chair. Madam Chair.
Yes. No, I'm not chair.
Yeah.
Senator Hutchings.
Madam Chair, thank you. I agree with Senator Brennan. Unfortunately, I could not be on that working group, but I would love to see us dive into the topic, the pharmacists and the physicians working together on, their skills and abilities and relinquishing things that they can and cannot do or whatever. I think it's important, and I think we should get that going. Thank you.
Chairman Brennan.
Thank you, Madam Chairman. I think we've asked, I think a good place for now then to start is just having the School of Pharmacy come and just more education on that, because I'm not sensing that anybody's super eager for a working group right at this time. And so I think just some more education would be great for us, which we've already talked about. And if I may also, Madam Chairman.
Yes, please.
I would like us to ask LSO, or would it make a motion that we have LSO maybe look into Utah, and if there's other states that have done personal asset protections for physicians, if we could look at that and maybe get a draft bill going for the next meeting, I would move that we do that.
Second.
Okay, is there any other discussion on that? We have a motion and a second. Looking into personal protection for medical professionals, correct?
Mm-hmm.
Okay, all in favor, say aye.
Aye.
All opposed, no? Okay,
And if I might, Madam Chair.
yes?
I know. Thank you. I'm almost done bothering you, Madam Chairman, and we'll let everybody go home. Maybe. The other thing that I think that we've heard and that I feel like we don't have, I think there's pieces of data in different spots, like there's different maybe pieces of data here and there for what we have healthcare wise in the state, but I don't know if we've got that all pulled together. LSO, I guess my question would be first to LSO, what's kind of your sense of that? And what I would either like us to kind of pull some data together, or that's where I would like to start is we heard bits and pieces of like, well, there's some data here and some data here and some data here. Could we get that together kind of in like a memo of what data that we do have?
Madam Chairman, Chairman Brennan, I think we can probably pull that together.
Okay. All is well, huh? All is clear. And I have a question. Earlier, and this is a place to look. Earlier, I believe it was the Department of Nursing said that there was so many spots available for CNAs and CNA 2, but that we weren't getting all of the CNAs because those spots were being taken by people that were going to go into the nursing program. Is there a way that we can talk with someone about if that could be adjusted for more spots or spots specifically to go through that training in the nursing program versus just to go through that program to be a CNA?
Madam Chairwoman, I think that requirement is probably school by school, but we could definitely look into that.
Thank you.
Madam Chairman, thank you. The one thing I was interested in asking for that hasn't been asked yet is just a memo on what other states do for loan repayment plans for doctors that as an incentive to get them to move into the state. So just a memo, don't need a draft yet. I want to see what other states are doing.
And LSO, I have another question. What did we have on our next agenda? Nothing? So all of these things could be exactly that agenda? Perfect.
Yes, Madam Chairwoman.
It will be a full one.
Yeah, we haven't really hashed out the next agenda yet, so it's,
Okay.
it's pretty open.
Okay, thank you. Senator Hutchings.
Thank you, Madam Chair. I've actually never proposed a bill draft during a committee, but when Mrs. Decklever was talking about the APRNs, she said that they feel a very specific void, and that with shortages in that area, of them not being able to admit people to hospitals, that they must be under a physician in order to deal with their patients in the hospitals. I don't know what that would look like. She mentioned that that was something that was important. I don't know if we have to talk to Tony, if she's still there and can add some more information, but she talked about something in the statutes being changed in that regard. So I don't know if we could get with Tony and maybe, or if I need to get with Tony and maybe draft something to help those APRNs be able to admit people to hospitals because of their specific training and knowledge. Just a thought.
Thank you. Co-Chairman Brennan.
Thank you, Madam Chairman. This was something that I kind of briefly talked to Mrs. Decklever about over lunch and exactly what that, a little bit what it looks like. I think there is some stuff statutorily that does allow for some. There's also, so it kind of depends. It's very hospital to hospital, like the association said, because some of them can admit but have to work under the physician. And so I think it might just be a matter of pulling up the statute and what the statute says in there, because I'm not exactly sure.
So, Madam Chair, how would
Yes.
you help direct this particular request? As a research, a bill, changing statute? I don't know. Since Senator Brennan has already talked to Ms. Decklever, maybe she has some ideas.
Okay. And thank
Easy or
you,
not?
Senator Hutchings. The one thing that I would ask, and I think the committee's here talking now, is that whether or not that is in that scope of practice, or if it's just a statutory change, or exactly how that could be maneuvered to make that independent. I'm not sure. Does anyone here have an idea on that? Senator, or yeah, Chairman Brennan.
Thank you, Madam Chairman. I think at this point, it's just a matter of the education on what our current statute says and pulling that up. And I'm sure that we can get that from Mrs. Decklever and LSO and reading what exactly we have in statute currently.
Right, Madam Chairwoman, I could look that up fairly quickly, and I think actually, yeah, we can look that up
Thank you.
and send it to you.
Appreciate that.
Representative Thayer.
Thank you, Madam Chair. I wasn't sure if co-chair was done. I just had a couple other comments. I just didn't know if co-chair was completed on her list.
She has said that she is finished.
Oh, sorry. Okay. I just looking at my list of ideas and things we've talked about the last 2 days, I guess again, kind of being new to this committee and the tort reform that we've discussed the last 2 days, I guess again, we're asking LSO to do a lot of work, but this was one of the ideas or topics kept coming up the last 2 days. I don't know if they can just give us an overview on the last time we have worked on that or done anything. I could be wrong, but it just, as I was going through my notes that did just kept rising to the top. So I'm not sure, Madam Co-Chair, if the rest of the committee has more information and we can just get a report. Is that something we want to continue to look at as a whole committee? So that was the first thing. And then the second thing, and again, my internet was going in and out, so it kind of broke off a little bit, was the exchange program and getting more information on the exchange program that we discussed today also. Thank you.
Representative Thayer, more information on exchange program. And I'm sorry, could you remind me of what it is exactly that you're?
Sure, we've gone over a lot. The exchange program where I think Eric Boley from his previous position has brought in or has had physicians go to other areas and they've exchanged and learned more services or gotten more time on a specialty. I can't even remember who it was. I think Miss Bush brought it up once and somebody else brought it up. So the exchange program.
And just to clarify that in my mind, is that to like cross-train, but also to help people get their hours of training and keep updated? Is that what we're?
I guess that would be a great question because it was very broad. So maybe we could go back and get a deeper knowledge on a one pager on what exactly can an exchange program do and how would that assist with our medical services in the state of Wyoming.
Okay. Thank you. Representative Clouston. Okay. LSO, is that good? I don't think that was a motion. Representative Thayer, are you good?
Yes, I'm sorry. I didn't know if that needed to be an official motion. I thought we were just, so if it does, I guess I
Thank
would
you.
ask. Yes.
Madam Chairman.
Okay. Senator Scott.
Madam Chairman, on the tort reform that was raised, I think what we found was that while it's still an issue and a particular difficulty in the obstetric, the OBGYN area, frankly, what we've tried before failed in the election, and we don't have the votes to do anything meaningful at this point, and we don't have a new crisis that would justify us in a major effort to get them. So we're lacking ability to do anything there. So that's been our experience. On the exchange program, I think basically there wasn't a legislative issue there. It was something that could be, we've done what we could to facilitate with the Interstate Physician Compact. So it's now a matter of other people can do it on their own without needing us involved.
Madam Chair.
Representative Thayer.
Yes, thank you, Senator Scott, for answering my questions. I will just look into those myself then, if that's not a committee issue. Thank you for that information, Senator Scott.
Representative Clouston.
Thank you, Madam Chair. So if the committee would be agreeable, besides Wyoming, we talked a lot about Wichita. One of my local veterinarians asked, why is the veterinarians the only profession that does not have to come back to Wyoming and work? So saying we have a large, we have a shortage of veterinarians in Wyoming, especially large animal. And we're letting these veterinarians get money, we assist for their school, but they're the only profession not required to come back and work in Wyoming to repay that. So he was asking me why, and I didn't have an answer for him. I don't know the history of that. So again, maybe besides just Wyoming, we could get some information on Wichita and maybe bring that topic to discussion.
Representative Clouston, so the veterinary school is through Wichita?
Thank you, Madam Chair. So yeah, Wichita is one of the professions, veterinarians are one of the professions covered under Wichita. All the other professions to get their loan forgiveness have to come back and work in Wyoming for 3 years. For some reason, the veterinarians have been excluded from that requirement. So when he asked me, I didn't have an answer for him.
Second. Representative Rodriguez Williams.
Thank you, Madam Chairman. I appreciate the concept of that and would probably support legislation on that. But I would just ask the good co-chairs whether or not that is an approved topic. I know that the representative from Teton County mentioned that he didn't want to see the committee just drafting bills willy-nilly. And so if you're compiling a list of potential topics to bring to Management Council, I would support that, adding that to the list along with the SNAP waiver.
Thank you, Representative. Representative Clouston.
Thank you, Madam Chair. So, and the reason I brought it forth is because we had quite a discussion yesterday on Witchy. We covered it in several areas. So I felt like it's probably a topic we have covered and we'd approve talking about Witchy. If the committee doesn't want to handle that in the next meeting, then I'm okay with that too.
Okay, and as, as far as problems with recruiting and things like that, it may be a topic. Yeah. Are we developing a Management Council list? Is that what we're doing? No.
Madam Chairwoman, I think there's only 2 things on that list if there is a,
Okay.
but we can discuss this after the meeting too.
Okay, that would be great. That would be great. We'll do that. Thank you. Okay. Okay, is there anything else that the committee would like to bring?
Sure.
We are adjourned. Well, till October, I guess. Thank you very much.